time for PetSylvania with Dr. Bob Esplin. Dr. Bob guides you through the latest veterinary techniques and procedures to keep your pets in the best of health. PetSylvania is brought to you by Elanco, maker of Trifexis and Comfortis. With your ears up and tails wagging, here is Dr. Bob.
Good morning, PetSylvania listeners. I'm Dr. Bob, as the announcer said, from SylvaniaVET. I'm proud to represent the best vet practice in Northwest Ohio for the last 6 years, according to the Toledo City Paper and the Toledo Parent News. I am also pleased to have Elanco, the makers of Trifexis and Comfortis, as our sponsor. Just got back. I kind of smell like a cookout right now. My producer's drooling actually over here because I smell so appetizing. What we did is we did a cookout at the office today as a appreciation day for both clients and our staff. You know, as successful as we are, we couldn't be half that successful without a great staff, and we have fantastic staff in every department. And I'm just really proud in any small way to thank them for the effort that they give without complaining. Days drag on. I'm going to tell you a little bit later about a case that caused my tech Lisa to be an hour and a half late getting home. But we had a great time. We're going to do this once or twice a year. Just another thing that, the clients that were there, they all participated in and out. Some came in specially. It was just a lot of fun, and it was great to talk to people and hear them make comments about the office. One of the interesting things that we've seen this week, and I don't know why suddenly this week it's happened, the popularity of Trifexis, the once-a-month tablet that protects dogs against both heartworms and fleas and also protects against internal parasites, is growing in popularity across the region, and I think that it should, because it's a terrific product. One of the things that we are beginning to wonder is we've been getting a lot of phone calls, people asking us if they could come to us to buy their Trifexis. So they know that we carry it, and they've heard that we have really good prices. We've had two clients that commented that their vet wanted to charge $22.50 a pill for each small dog, which is a 5 to 10 pound dog, each small dog dose of Trifexis. Our price for that same product, the same dose, is $14.25, and that's a huge difference. And if you buy 6 of those Trifexis from us, that's $79.50. That brings the cost down to just a touch over $14.40 a dose. And then on top of that, when you buy 6, there's a $10 rebate coupon from Elanco that brings that cost down even further. So it's a really good deal. Now the problem is that, and we'd love to say, yeah, come on in. However, it is a veterinary registered pharmaceutical and can only be sold to somebody when we have a client-patient-doctor relationship. And that means one of our doctors has had to examine the animal within the last year, and we have to have a record of that examination. So what we've decided to do, because we would love to be able to sell the Trifexis and have people come in and meet us free of charge, we're going to have a short, get-acquainted examination of your pet. All you need to do is call 419-885-4421. Say, I'd like to buy Trifexis, but I'm not a client. I'd like to come in and have my complimentary quick visit. We'll do that, and then we'll sell you at least 1 dose of Trifexis, and the visit and the exam will be free. I can't think of a better deal than that. We honestly believe that if you learn about SylvaniaVET, if you come in and you take the tour, if you get our Welcome to the Practice folder, and you really understand everything that SylvaniaVET stands for, has to offer, and is the fact that we're there 24/7 for your pets, you're going to want to come back. You're going to want to, at the very least, keep us as your backup. But when you see that we can do some pretty amazing things all in-house, I think that it's something that you would want to think about, even though we might not be the closest practice to you. I think that one of the things that, I always like to try to talk about cases that we had, and it seems like there's always several really, really interesting cases where our capabilities are tested, and that's the thing that we love about veterinary medicine. We love meeting the clients, and we love doing wellness visits and the vaccines, and all the other routine care, and we certainly enjoy and understand how difficult it is if you have a dog that's itchy and it has flea allergy or it has seasonal type allergy. But what really turns us on is when we're challenged medically and surgically, and our nursing care is challenged. And we had a case like that this week. KJ, who is a Sylvania dog, came in. It was determined that he had a large mass in his abdomen. We talked last week about the dogs with the large mass, and it turned out to be the spleen. I'm thinking, oh, here we go, third dog, and they always come in threes, and so I've got my third dog with a splenic mass. We could see it on the ultrasound, and so we're doing that right away. The good news is there wasn't any fluid in the abdomen, but the strange thing was it just didn't look like most splenic tumors, and it was a little further back in the abdominal cavity than where we would normally expect it. So the client said, let's go to surgery, and we went into surgery, and I found I'd post on Facebook, but I think I'd get half my friends fainting if you saw the pictures of this tumor that I removed. But the tumor was from a small part of the intestinal tract where the small intestine and the large intestine come together. There's an organ called the cecum, and this mass came off the cecum. And when we got it out and got everything taken care of, we weighed the mass. It weighed 3 pounds. Well, we were in surgery quite a while, and this was very stressful for KJ. And as a result, his recovery was a little bit rough. And so one of the things that we have the capability of doing is monitoring acid-base balance. And by monitoring acid-base balance, we were able to tell that KJ needed to have additional oxygen, more than the average dog recovering. And it also needed to have a medication called sodium bicarbonate because it was very acidotic. And so sodium bicarbonate is an alkalinizer, and it alkalinized in a period of about 3 hours. By doing multiple blood gas tests, we were able to get him to wake up and thrive. He went home yesterday. His parents came in for hamburgers and hot dogs today, and so that was really great, and he's doing well. And now what we have to do is we have to wait for the pathology to find out what it was, and we'll go back from there. The cases from last week that we talked about, they're getting prepared to have some follow-up chemotherapy. One of the dogs, we're going to do that, and the owner is going to attempt to do a holistic approach to the cancer therapy, and we're going to be a part of that, and we're going to be extremely interested to see how that goes. That's one area that I feel absolutely incompetent on when it comes to dealing with the holistic side of caring. I'm obviously much more of a traditional doctor, but I'm very open-minded, and so are all the doctors at SylvaniaVET, open-minded to some of these other modalities, and we will support a client regardless of their decisions and help them in any way we can get through a significant treatment like that. And we'll have the two cases going parallel with one another. I guess we could maybe check and see how one does better than the other. So that's that's kind of our case of the day and case of the week. And I know there will be one next week. I'm hoping it'll be a medical case, something that we can talk about, because so far we've talked about just amazingly disgusting abdominal masses, and there are other things that we do. Something as simple as cryosurgery to remove a bunch of little skin growths from a dog without requiring any sedation. We can do that in the exam room as an outpatient. No pain to the dog, very quick and easy. Really a cool way to get rid of small skin growths and skin cysts that dogs get. Well, it's time flies by. I just talk an awful lot. It's time for us to break. Just before we break, though, I have a quiz for you, which we'll answer after the break, and that is, what is more calories, canned cat food or dry cat food? So when we left, I asked you a quiz. What has more calories, canned cat food for cats or dry cat food for cats? And most people, when they guess and they're in the office, they guess canned food because it's got all the, it's got all the fat and everything in it. The reality is that canned cat food has 1/3 the calories, ounce for ounce, of dry. A quarter cup of dry dog food is roughly an ounce, and a sixth of a can is an ounce in a cat. And the reason there's that big difference is that canned food is 70% water. And so there's no calories in water. And even though there is some fat, that's what brings it down. And interestingly enough, in cats, there's several things that you should know. One is that cats should not eat just dry food, even though it's terribly convenient. It's not ideally designed for their metabolism, and it creates an opportunity for them to gain weight because of the calorie density and because they lack two enzymes for proper digestion of carbohydrates. And then, so if we have a diabetic cat that has dietary demands that require it to have a high protein, higher fat, low carbohydrate diet, we put them on canned food. And if we have a fat cat that we need to diet and we need to do so gradually, we put it on canned food. Ideally, what I suggest is half of your cat's diet per day be dry and the other half be canned. And that's a great compromise in a way of feeding a cat and getting all the needs. If you use the special dental diets, then they get some dental benefit out of eating that dry food as well. But they get the benefit of the extra protein, the extra fat by eating the canned food. So that's the ideal way to feed a cat. They also get more dietary water, which is healthier for them for their urinary tract. I have a friend, Dr. Carrie Bean, who is in practice in Indiana, and we communicate back and forth periodically. Telling stories about practice and asking and answering questions of each other. And recently, she had a client in to her practice that's a breeder of Chihuahuas. And as she was examining a number of these Chihuahuas from the breeder, she noticed that absolutely every one of them needed dental disease. And the comment that the breeder made to her was, well, I don't really worry about dental disease in my dogs. Very hard to not get into an argument about that kind of a client. That she had no success in convincing her that this is a serious health issue. I would certainly agree with her sentiment. This is a serious health issue. Small breed dogs like Chihuahuas and Maltese and Yorkies and Dachshunds, as we get a little bit bigger, they have a higher than average incidence of severe dental disease. They get gum disease. They get red swollen gums. They get periodontal disease where they start to lose bone. Their teeth are loose. When you have a loose tooth, if you have a red swollen gum, that's painful. So your dog is in pain, even though they don't know how to tell you that. They don't remember when it wasn't painful. So as a result, they just go on their merry way. They don't feel real bad for themselves, but they're not healthy. It's a real debilitator for them. And the number of clients that come back after we've cleaned dogs' teeth, extracted teeth that need to be pulled. The rough rule of thumb is that if a tooth should be pulled, if more than half the root is exposed, and so that there's less than half the root anymore anchored in the bone. Many of those teeth you can wiggle, even though they may have 3 roots and you think that they would be pretty solid, they can still wiggle. How are they still able to eat? Well, many of these dogs no longer chew. They just gulp their food. And so feeding dry food in that case won't necessarily help. And in reality, feeding dry food to a dog or a cat with the idea that if they crunch that dry food, it's really going to help their dental care is very much of an old wives' tale. It helps very little. Most of the foods that are out there, unless they are specific dental diets like Hill's Prescription Diet, TD, are hard baked, and so if they do crunch it, what they do is they pulverize it and it powders, and then that powder catches on the teeth and gets up underneath the gums, acts as a nutrient source for the plaque bacteria, and just perpetuates the problem. What can you do? absolutely the best thing is brushing your dog or your cat's teeth. Get started when they're young so they get used to it. It's part of the routine, making it a positive adventure. In an older dog, you just got to take your time and you got to get there. And if you do that, I think you'll have success. We do a lot of dentals at SylvaniaVET, probably on average 3 to 6 a day. It's safe in our hands. The level of care and monitoring that we provide is there. And I always tell clients if they're reluctant, I said, if we had a pus-filled mass in the middle of the back oozing, and I said, we've got to take that growth off, you'd say yes, because nobody wants an open oozing wound. Well, that's really what's going on in a dog's mouth that has severe periodontal disease. If you can smell your dog across the room when you walk into a closed room from their breath, it's way beyond time to clean their teeth. So, I would certainly suggest if you're uncertain, if you're worried, again, the commercial, come check us out at SylvaniaVET. See how we monitor and care for patients when they're there. You can stay and be a part of it, and you can hug and hold your pet before and after as it recovers from the necessary anesthesia. So nothing secret behind the closed doors at SylvaniaVET. And as a result, you're welcome to come and stay and watch if you like. It doesn't make us nervous at all. So one of the things that we spend a lot of time on with our new puppies when they come in is getting them oriented in the household so that the housebreaking goes smoothly. And by the time we're 4 months old and we're finishing up our vaccine series, the puppies, most of the puppies are housebroken. And so we've broken housebreaking down into six steps. We have an outline that we provide to clients at that first puppy visit. And in those 6 steps, we're going to just kind of run through them. And you want to feed a good high quality food. We've talked about those before. The foods that come from Hills, Iams, Royal Canin, and Nestle Purina are the foods that we recommend. Those are excellent quality puppy foods. Learn how long after a puppy eats is its urge to go to the bathroom so that you're in a position then to be ready to take the puppy out. Start talking about going potty as you head outdoors. Go to the same door, stop at the door, try to get the pup to respond. Out you go. You're out there with your dog. Take an umbrella if you need to. Wear your galoshes if it's winter, but get out there. Shovel the grass if you need to. You go out. You're talking about going potty. We're going potty. Then we start to go. We say what a good dog we are, and then we reward that with praise and petting. Take the food with you. Do not give the reward when you come back in. It's too late. It won't work. No freedom that the puppy hasn't earned. Don't let it run free in the house when you're home. Use a cage. That's its bedroom. It'll feel good about that space. In most dogs, most puppies like it. They feel like they can go in there and they'll actually put themselves in there if they want to get some rest. Pick up on the signals that say, I got to go, all right, and hustle outside and turn a negative into a positive. And then if you catch the puppy in the act of pottying, distract. It's your fault. You missed the signals, all right? So don't punish. It doesn't do any good. And puppies don't respond well to that. And, even though sometimes when you come home, you say, boy, they sure act guilty. They're picking up on the body language that you're saying, either as you're looking around for the mess that you anticipate might be there. They're really, really adept at picking up body language, and they understand that. But I know of no behavioral experts. I know of veterinary or otherwise. I know of no psychologists who study animal psychology that feel as though puppies feel guilt, that dogs feel guilt, that you can make them feel guilty. You can make them fear you by punishing them. You're much better off rewarding the positive and doing everything you can to avoid the negative. And ultimately, you're going to have a much better puppy. So we're about to break again, and then we'll put a wrap on it. Well, hi. These half hours just go so fast. So I got thinking when we went to break about the cage. You know, the cage is there to help the puppy control its housebreaking and its keeping it from wandering away. But you know, it's also there for the other side. If you have a house with a lot of young children, it can become a sanctuary for the puppy when it sometimes just gets overwhelming for them, and they can go put themselves away. And one of the things I frequently tell families with young children is that the cage is the dog's bedroom, and it's not to double as a fort for the kids. Let the puppy have its own space. My preference is it is a cage. It's that own space is not on your bed or the kid's bed. It may be that cage is in your bedroom. That's fine as far as I'm concerned. Pups are social animals, and they like knowing that there's family nearby. But dogs don't belong in your bed, and kids don't belong in the dog's bed. So I think if we keep that separation, we're going to be in much better shape. So a few reminders here for you. One of the things that we do at SylvaniaVET is on our website, we publish a monthly electronic newsletter, and it covers many of the topics similar to we do here on PetSylvania, but in more detail and a great many more articles. And there's free subscription to that. You go to www.SylvaniaVET.com and look for the icon in the lower left-hand corner where you register. Put your email address in there, and you'll get the monthly FYI for Pet's Sake emailed to you every month. Sunday this week, the 22nd, we have an adopt-a-thon at SylvaniaVET from noon to 3. We welcome everybody to come to the adopt-a-thon and look for a forever pet if you're in that market, or it's just a lot of fun to come and see all these other animals. It's an adventure, and if you've never been to the office, it's a great way to come and see SylvaniaVET, on your own, without any animals there, without any pressure. You can just take a tour, and all you got to do is ask one of the employees that's there. Of course, we'll be working. We're open from 11 to 3 on Sunday, so a doctor, which will be me this Sunday, will be working, seeing irregular appointments during the adopt-a-thon. Pizza Palooza is Friday and Saturday, the 27th and 28th. I'm a pizza judge. I want you to feel free to come out. It's $5 for adults, and it's $3 for children 6 to 12, and under 5 and under is free. Going to be 8 bands, 9 pizza producers, lots of fun, lots of beverages, and so everybody can come and just have a great family outing. Come out, buy your tickets. We have tickets at SylvaniaVET if you want to stop in and buy them, or you can buy them at the gate. I think those are two really fun things that we do. Again, I want to remind you about the Elanco products, the Trifexis, which is a combination for heartworm and fleas. But if you're already using a heartworm medication and you want to use something for fleas, then Comfortis is a once-a-month flea pill that you can give in conjunction with it while you're using up your current heartworm preventive. And so that's a way to get going. It is recommended that we use both heartworm and flea control year-round on your pets, regardless of what the weather is like in the winter. We're hearing, somebody was telling me today that they're saying that they've heard that this weather that we're experiencing right now is going to continue well into October. If that's the case, we're very much likely to have a mild fall, which means that fleas will last longer than normally. We normally have fleas gone outdoors by Thanksgiving, but we had fleas throughout the winter, this past winter, because it was so mild, and some fleas survived, and it was an ongoing flea problem. So flea control year round is a really good idea. You're also getting internal parasite control with Trifexis as well, and then your year round heartworm. So we're accomplishing 3 tasks with 1 pill. It becomes pretty darn economical. So again, thank you. PetSylvania will be signing off, and I want to say that there's only one best pet, and it lives in your home.
You have been listening to PetSylvania with Dr. Bob Esplin on WSYLradio.com. PetSylvania is brought to you by Elanco, maker of Trifexis and Comfortis. Tune in every Saturday at 10 a.m. as Dr. Bob explains the latest in veterinary care and answers your questions. You can email your pet questions to requests@WSYLradio.com, and Dr. Bob will answer them on a future show.